Hey everyone, and welcome. Today, we're going to talk about something that can be filled with all kinds of emotions. Anticipation, nerves, excitement, and that's using a home pregnancy test. We're going to break down exactly how to do it correctly so you can actually trust the result you see. Okay, let's get right into it.
So it seems pretty simple, right? A few drops of this, wait a few minutes, and boom, you have an answer. But here's the thing. Little mistakes in how you do it or when you do it can totally throw off the result. And when so much is riding on those little lines, you have to ask yourself, are you really sure you're doing it right? Let's find out.
So before we even get into the how-to, let's talk about the how-come, the science of it all. Because once you understand how these little tests work, you'll feel way more confident in the result. And honestly, the biology behind it is pretty cool.
Okay, it all boils down to one thing, a hormone called HCG. Think of HCG as pregnancy's first little text message to the body. As soon as an embryo successfully implants in the uterine wall, the brand new placenta starts pumping out this hormone. And HCG is the exact signal that these tests are designed to pick up.
So how does that signal get from inside your body onto that little test strip? Well, the HCG first gets into your bloodstream. Then your kidneys do their job, filtering your blood, and some of that HCG ends up in your urine. So the pregnancy test kit has one simple job, and one job only, to spot that specific hormone in your urine. That's it.
Okay, so now we get the science. But, that's really only half the battle. Knowing when to test and how to get ready for it is absolutely critical. And honestly, this is where a lot of us can trip up and get confusing results.
Let's talk about timing, because timing is pretty much everything here. Now, I know some tests say they can work super early, but for the most reliable, accurate result, the best time to test is about 4 to 6 days after you've missed your period. Why? Well, it's because by then, your body has had enough time to build up a detectable level of HCG. If you test too early, you might get a false negative, just because the hormone levels aren't high enough yet.
So we know which day to test, but what time of day is best? This is another big one. The golden rule is this: try to use your very first urine of the day. You see, overnight, your urine becomes a lot more concentrated. That means any HCG in there will also be at its most concentrated, giving you the best chance for a clear, accurate result. If you test later in the day after you've been drinking a lot of water, you could dilute the sample so much that the test can't pick up the hormone. All right, before you start, let's run through a quick pre-test checklist. First, and this is so important, always check the expiration date on the box. An expired test is just not reliable. Second, make sure whatever container you're using for your sample is totally clean and dry. The good news is these kits are easy to find and pretty affordable.
Okay, you've got your kit, you've picked the right day, and you're ready to go. So now, let's walk through the exact steps to make sure you do this the right way. It's really just 3 simple steps. So, step 1, collect that first morning urine in your clean container. Step 2, take the test out of the wrapper and use that little dropper it comes with to put 2 or 3 drops into that little round window. That's the sample well. And finally, step 3, probably the hardest part. You just lay the test on a flat surface and wait.
Now listen up, because this next part is so important. You have got to read the result within the time frame the instructions give you, which is usually somewhere between 90 seconds and 5 minutes. If you let it sit out for, say, 10 or 20 minutes, something called an evaporation line can show up as the urine dries. It can look like a faint positive line, and it is super misleading. So stick to that 5-minute window.
Okay, the wait is over, the timer went off. Now it's time to actually read what's in that little window. This is the moment of truth, so let's make sure we know exactly what we're looking at.
So, in the result window, you'll see 2 letters, C and T. C is for the control line, and T is for the test line. Now, the control line must show up. Think of it as proof that the test is working correctly. If you see a line at C but nothing at T, that's a negative result. If you see a line at C and a line at T, that's a positive result. And now for the question that causes the most confusion of all. What on earth does it mean if the test line, the T line, shows up but it's super faint, like you have to squint to see it? Is that a yes or a no?
Okay, here is the simple answer. Any line at all in the T-spot, no matter how faint it is almost always considered a positive result. It just means that the test did detect HCG, but the levels are probably still pretty low because it's early. The best thing to do? Don't stress about it. Just wait about 3 or 4 days, let those hormone levels rise, and then test again. You'll likely see a much darker, clearer line.
Look,
No matter what result you get at home, you have to remember that this is a screening tool, not a final medical diagnosis. So if you get a negative result, but your period still doesn't show up, or if you're just not sure about what you're seeing, that's your cue to take the next step.
And that brings us to the single most important piece of advice. While a home test is a fantastic first step, the absolute best way to know for sure is to see a doctor. They can do a blood test or an ultrasound to give you a definite 100% certain answer. Because at the end of the day, getting that peace of mind, well, that's what this is all about.